Hey, it's the Happy Doctor. Today I will be speaking to the men. This video is dedicated to the men, and I am speaking about the prostate. The prostate and the conditions that commonly affect the prostate. So what's the prostate? The prostate is a small walnut organ. It's actually a gland in men, and you find it somewhere just below the bladder in the male reproductive and urinary system. So that little gland is very important because it produces a fluid called seminal fluid. That fluid it produces is what nourishes and transports sperms. And sperms are the male reproductive garment. So that tells you how important the prostate is. So the two common conditions that affect the prostate is actually what we call benign prostatic hypertrophy, or you can call it benign prostatic hyperplasia, commonly called BPH. You can simply call it BPH, benign prostatic hypertrophy. The second condition is what we call cancer of the prostate. So I'll right away go to speak about benign prostatic hypertrophy, or what we call benign prostatic hyperplasia, and you can abbreviate it as BPH. So BPH is relatively common in men, but it's common mainly in men above 50 years of age. 26% of men in that category actually suffer from it globally, up to 26% of men. And there was a very interesting rise in its prevalence from the early 2000s to about 2021. By 2021, the men who had BPH had risen, the number had risen from 51 million to about 112 million. So it's expected that this condition is on the rise up to the 2035s. That's why we need to talk about it. You're asking, Happy Doctor, what are the risk factors? Could I be at risk? Yes, I'll tell you what the risk factors are. One, I have already pointed you to age. As a man grows older, the risk for developing BPH also increases. So men that are 50 years and above have a risk, and this risk increases with increasing age. So that means a man that is 60, 70 has a higher risk than the one that is 50 years of age. Then the other risk is genetics. If you have a family history of men who have had issues with their prostate, then the risk for developing BPH increases. The risk does what? Increases. The third risk is lifestyle, and people, lifestyle is very important. What you feed on, managing your weight, your health habits are very, very important in managing and preventing BPH. So how do you know that someone has BPH? What are the signs? What are the symptoms that someone could be having BPH? So I will categorize for you those symptoms into two groups. They are what we call voiding symptoms. Voiding symptoms. Voiding simply means emptying. Yes? Symptoms that come at the time of emptying someone's bladder. And then there are what we call storage symptoms. Storage what? Symptoms. So I'll begin with the voiding symptoms. So some of the voiding symptoms include a weak urine stream. So a man goes to pass urine, but the stream is not as strong as it was when he was 45, when he was 40 years old. It comes very weakly, or if it doesn't come weakly, it comes intermittently. So it might come and then stop. You might find that your father or your friend is complaining of that. So that is one of the voiding symptoms. Then the other one is hesitancy. What we call hesitancy. Someone goes to the washroom, but they take time for the urine to come. So they feel like it should come, but it's not coming. They feel it's coming, but they have to wait for the urine to come. Then the other voiding symptom is what we call dribbling of urine. Dribbling of urine. Dribbling is simply someone passes urine, and at the end of the stream, the bladder is not yet empty. They don't feel the emptiness. So urine comes out in dribbles, in drops, and they have to wait for that urine to get finished. So I'll now look at what I've called the storage symptoms. Storage symptoms of BPH. One of them is increased urinary frequency. So you find somebody at night, they are passing urine so many times. They have to wake up at night, so they will be complaining that they are not getting enough sleep because they have to wake up in the night. And then the sensation of not emptying the bladder. So they go to the washroom, pass urine, but they still feel that they have not emptied their bladder. Their bladder is still full. Then the other one is urgency, what we call urgency. Just from the word, the way you hear it, urgency is when someone feels they must go to the washroom now. And guess what? A lot of these men, unfortunately, sometimes they are in a party, in a public place, and because they cannot hold it, they actually wet their pants. And it's very embarrassing. So those are some of the symptoms that can tell you that someone is actually suffering from, maybe having BPH. So how do we actually make a diagnosis of BPH? Now, a diagnosis of BPH will be made by your healthcare provider. If your colleague, your friend, a relative is suffering those symptoms I have mentioned, please seek the attention of a healthcare provider. And what will they do? They are going to take history, what we call medical history. Ask you about those symptoms, the family history, your lifestyle, just like I have explained. Number two, they'll do what we call the medical examination. So there is a medical examination which is called a digital rectal examination that will be done to establish if the prostate is actually enlarged, if it is big, because hyperplasia simply means a big something going out of its size. So the healthcare provider will establish if they are able to touch the prostate. Usually they shouldn't be able to feel it. Then there are tests that will be done to make sure that cancer